Greetings from Citizens Health Team under Academia IAPSME Connect. In the series People's Health It Matters, today we have Dr. Anusha. She is MD and DNB in Preventive and Social Medicine, and she is working as a clinical lead for research and innovation in Preventive Health Department at Apollo Hospitals, Bangalore. A very warm welcome to you, ma'am.
Thank you so much, Shivani. It's a pleasure being here. Thank you.
Yes, ma'am. So, today we are going to discuss a very important and interesting topic, that is preventive health checks. So, ma'am, preventive health checks, what are they and why are they important to me as an individual?
Okay, preventive health checks refer to a lot of things. It can include medical examinations, screenings, tests, vaccinations, and consultations with your doctor. So, main aim of these is to prevent the health risks before they develop into a serious health issues. This is a proactive approach for maintaining and enhancing individual well-being. When you say why they are important, there are a lot of reasons. First and foremost, early detection. So many diseases are most effectively treated when caught in their early stages. So preventive health checks can identify problems even before the symptoms appear, and making treatment more successful and less invasive. So that is the first thing. The second is prevention of diseases. Now we understand recently there was an ICMR report, and India is becoming a capital of NCD. So by identifying risk factors such as high blood pressure or high cholesterol, preventive measures can be taken like lifestyle changes or medication, and which can be implemented and can be prevented diseases. And also, preventive health checks are cost effective actually. In the long run, if you're preventing diseases now, in the long run, you're saving a lot of money for yourself and also for the healthcare system as a whole. And the overall aim of whatever we do is to enhance the quality of life. And by keeping track of your health and making necessary adjustments, you can improve your daily well being. And in fact, you can even expand your lifespan. So, I would say preventive health checks are a testament that you care about your health, and your family's health, and engaging in regular, preventive health checks puts you in charge of your own health and well-being, and about your future health. So yeah, that is why we need to talk about preventive health checks.
Okay, ma'am. I want to ask you, like, what kind of test, ma'am, when we are talking about preventive health checks, what kind of test do we consider in India?
That's very relevant today. So the preventive tests can encompass a wide range of tests and screenings. Okay, so there are tests that we talk about most commonly, like say blood pressure measurement, or we have blood tests like complete hemogram, also called as CBC, lipid profiles, kidney profile, glucose test. So these are the common tests that are offered by a lot of hospitals and also a lot of laboratories. We have so many service providers now. We can book these online, and they come and collect the blood at your home. So these are most commonly talked about. But there are also others which are very less talked about but are very important. Like say for example, cancer screening. Okay, so it's advised that every woman, when she attains 21 years age, should undergo a pap smear to test for cervical cancer. And you have to get it done every 2 years till you reach age of say of 60 years. But it's very less talked about. Similarly, we have mammogram for women to test for breast cancer, and it's advised that once you reach 40 years, you have to get the mammogram done and continue doing so for every 2 years. So tests like this, there is a eye checkups, dental examinations, and then we have bone density testing for osteoporosis and to predict the falls, and pulmonary tests. The list of tests go on, but the baseline and the most important factor is, the test should be customized to you. Every individual is unique, and the test should be following your lifestyle, your family history, your existing health conditions, and age and the gender, etc., etc. Yeah.
And also, ma'am, who should consider these preventive health checks and at what age?
So the simple answer to that is everyone and at every age. So there are tests that we all of us should get done as a baseline, and should be doing at regular intervals, and that there are tests which are very specific to some age, some gender or pre-existing conditions. For example, basic screenings like immunization or like complete hemogram are useful for everyone at every age. But when we talk about specific age groups, like say children and adolescents, children are the growing population, right? Like they are developing and they're growing. So, immunization and growth monitoring becomes very important at that age. And when we talk about adolescents and adults, this is the stage where you're exploring your sexual activity. That's where your family is expanding. So, talking about sexual health and screening for sexual health problems, fertility problems is important. And also, this is the stage where you should get your baseline NCDs checked. Okay, like your blood pressure, your glucose, your lipids. This will form the basis on which you can compare your future health. Okay, and as you age there are a lot of problems, like say in the elders, older adults, we have hypertension, diabetes, and mostly NCDs, but also some of the infectious diseases. And in the senior citizens we have cancers coming up a lot, in a huge number. And then we have glaucoma, there is mental health which is very neglected, like cognition, memory, etc. And also, like if you talk about only women, we have things like osteoporosis, which is more common in women than men. We have cancers like cervical cancer, breast cancer, etc. And in the men, depending on your risk factors, you might have to undergo testing for prostate cancer and then lung cancer. And also, like you're talking about individuals with risk factors like lifestyle risks, like say someone who's very leading a very sedentary lifestyle, they need to undergo test for lifestyle disease related diseases. And also, if someone already have these diseases, it's very important that they regularly get tested and monitor their progress, like their parameters. And so I would say, like preventive health checks is not just randomly getting some blood tests. It is first you should know what are your risks. Okay, and your test should be customized as per your risk. So know your risk first, discuss your risks and what are the appropriate tests to be done with your healthcare provider or a doctor or a physician, whoever you have access to. And based on these advices, you should create a schedule for regular health checkups. And regular is a word that is very important. It's not just one time thing, but you have to keep a track of things. And once the results are out, discuss these results with your physician or the doctor and take appropriate measures. And I think everyone should complement these preventive health checks with healthy habits for it to have a long term effect. So again, I'm reiterating the same thing. So every individual is very unique. So I think that is what is important. You should all these steps should go in tandem, and there's no point in doing only random tests once in a while, but should be a systematic approach throughout your life.
Okay, ma'am. Ma'am,
Yeah.
what are the annual health checks?
Uh, so, okay, it's very relevant in context of India because annual health checks are a common practice in many developed countries. These are comprehensive examinations which are typically done once in a year, and it is encouraged by both the employers and the government in countries like United States of America, Australia, Japan, South Korea, and a lot of other countries also. So in India, annual health checks are not a mainstream thing yet. Many hospitals and clinics are offering these tests these days, and a lot of people are getting this as part of their corporate wellness programs. And in fact, the government has started these annual health checkups and is promoting these, even under a lot of government programs, especially for people who are vulnerable, like the women, children, and elderly. So it's very encouraging. It shows that there's a growing awareness and acceptance of preventive health and preventive health checks in India. But I think there is a lot of scope for improvement. Like I think what we need is a cultural change where instead of being reactive to health, we have to become proactive and preemptive to health. And health checks and annual health checks is a big part of it.
Yes, ma'am. So, ma'am, what are the key messages you would like to give to the public?
Okay, only one thing. Preventive health is like, forming a team with your own well being. It's not just about a single test or a single activity. It's almost like a way of life. It's prioritizing you and future you. above everything else. So it's all about working together with your doctor to make sure that you stay healthy. And this includes regular checkups, treatments, and plans that are designed just for you. So, early detection is a key part of preventive health. By catching diseases early and other health issues early on, you have a better chance of treating them successfully. And in many cases, this can even save lives. So, I would say preventive health is not just about avoiding illnesses. It is also about lowering your risks of being getting sick, and also like lowering your risks of being addressing them early on is what is going to help them. So when you're informed about your health and take active role in maintaining it, you're setting yourself up for a healthier, happier life, not just for yourself but also for your family members. So I think that is the baseline, like prioritize you and your family's health before everything else.
Yes, ma'am.
Yeah.
Thank you, ma'am. This will definitely help to our public. And
Thank you,
thank you for
Shivani.
giving your valuable insight on this topic, ma'am.
Thank
Stay
you,
tuned for
Shivani.
the
Dr. Shivani.
Citizens Health channel. Yes.
Yeah. Bye.
Thank you, ma'am. Bye.
Bye.